Democrats and Republicans have been working on a national healthcare system since FDR was president. And the Affordable Care Act was an important step in that process. But like all great landmark legislation, we know that it's going to change and evolve going forward. So this is where we start. But what we know is the cost of healthcare continues to go up faster than inflation, and we can't afford that. Currently, we're spending a significant part of our budget on healthcare. And we talk about how we reduce the cost of healthcare, how we pay our physicians less, how we send people to see the doctor less, but what we haven't talked about is how to keep people healthy. Because healthy people go to the doctor less. They go to the emergency room less, and when they're in the hospital, it's for a shorter stay. So we have a system currently that the pharmacists I met with last night talk about a per piece basis for payment. That's how they get paid. And one of the things that we know is that incentivizes the wrong behavior. Now, healthcare is moving towards a system that is paying to keep people healthy. And that's where we need to go, because that's how we actually control our costs. If we keep people healthy, our costs go down. So that's where I would start.
The problem is it's too expensive. It piles tax after tax after tax upon businesses and people across this country. You tax medical devices 2.3%. You tax businesses 3.8%. You have a $2,000 tax on businesses that don't provide enough insurance. You have a $3,000 tax penalty on businesses who provide too much insurance. You have a 40% tax on so-called Cadillac plans. What equation they used, I don't know. But all of us in this room might want to take a look at that and see whether or not you feel 40% tax. Now they tax you for standing on the street, for deciding not to buy health care. That's just one side of it. The other side of it is this. My opponent has said in the past that she would do everything she could to protect Medicare and keep seniors' health care costs from rising. Well, if you support Obamacare, that won't happen. It won't happen. AARP cut a deal with the administration when they wrote this bill. What happens under this bill and benefits AARP and puts seniors in a big hole is this. Medicare Advantage goes away. Medicare Advantage disappears. Seniors have to go somewhere else. Those folks, we just had a hearing on this 2 weeks ago. Those folks that stay in Medicare Advantage, that get to stay, that might hang on to it for a while as it survives, will have their health care costs go up by $700 a year. $700 a year for seniors. That's a lot of money. Now, if they don't stay and they want to move to go to Medigap, here's what happens. AARP benefits by $1 billion in revenue over the next 10 years because they get a percentage for every senior that goes into Medigap. Now, why don't we tax AARP on the $1 billion rather than tax you and me on my health care plan and take away my choice to choose my doctor and my health care? Why don't we do that instead?
The Affordable Care Act does not come between you and your doctor. It is your choice. It provides coverage for preventative care. It allows you to keep your children on your account after they graduate while they're trying to get established. It covers you if you have pre-existing conditions. Those are important parts of the Affordable Care Act. Now, let's talk about who benefits. This is a program that asks us all to carry insurance and to be responsible for ourselves. I know I just renewed my car insurance. I'm asked as an owner of a car to provide that insurance. Guess what? It didn't come between me and my car to require me to have insurance. Now, all of those insurance groups out there, they're going to make a lot of money too, because there are more people who are going to be out there and shopping for insurance. Now, going forward, I think a public option would be great. I think more competition, I think bringing in the market would be an excellent way to keep costs down And frankly, I was happy that this law required insurance companies to refund policy costs to people and individuals and companies when they chose to spend less than 80% of your insurance premiums for your health care. I don't think we need to pay it for somebody's big bonuses. We need to be paying it to keep us healthy.